Concierge medicine, in the simplest form, is a throwback to the image of the old-time family doctor and his or her relationship with their patients. People are around now that remember Robert Young and Marcus Welby, MD. Marcus Welby always seemed to be there for his patients. He seemed to spend as much time as he needed. His patients seemed to be able to get a hold of him at any time, and he seemed to know very much about the patient's overall health condition and their lives because it related to their care. Also, what you didn't see in Marcus Welby, MD, was Marcus Welby filling out forms and paperwork. In other words, there was no interference with the doctor and the patient. Patients came to see the old-time Marcus Welby type doctor. There was basically a fee for his service, and the patient paid it. And it may not have been the same fee for everybody. Many older doctors remember getting chickens in return for their medical services. But the point was, this was a completely agreed upon relationship between the doctor and the patient. And both parties felt very engaged and very satisfied. So that's the basic. So what we're doing now with concierge medicine is we're trying to recreate that. So by having the doctor agree to reduce the number of patients they see so that he or she has a lot of time to deal with his patients. So most concierge medical doctors restrict their total patient enrollment to around 600 patients as opposed to a typical 3,000 patient primary care practice. They have lots of time to see the patients. They can get the patient in on the same day. They can spend extra time with the patient, and they can really give quality care. Nothing seems to be hurried or rushed. The patient, on the other hand, gets the benefit of being known, being able to rely on accessibility to the doctor. Most of the time, the concierge arrangement allows the patient to have a special number, like a cell phone number, email, or access through some type of patient portal setup. So this is the basis. Now, there's also a lot of value. The focus of concierge medicine is on preventative care. Most insurance companies have not paid for preventative care. And so this is the opposite. This is specially doing an executive type physical, nutritional risk factors in general, a lot more involved than you would get in a typical insurance-based primary care practice.